everybody. This is your host, Dr. Wasi, with another episode of your favorite Desi Table Talk. Please like, share, and subscribe to our program and hit the bell icon so you get notified whenever we post another video. My guest today is Dr. Naveed Sheikh, who is a pulmonologist and an intensivist. He has been on the front lines of COVID, and he has been treating folks with COVID, and he has been spending time in the intensive care unit. So I am sure we will have a very fruitful and very interesting discussion with him today. I would like to welcome Naveed to the show. Naveed has been my friend for several months, I would say more than a year, when we met, when we were actually at Hajj. So since then we have known the family and Naveed personally, so I've invited him to enlighten us about the ongoing COVID crisis, and we will try to do it in two parts. And part one today is mostly about what COVID is, how is it transmitted, what can you do to prevent and protect, and if there are any treatments. We'll talk about it, if not in this episode, maybe in the next episode. So Naveed, I welcome you to the show.
Thank you so much.
And of course, as you know, COVID has been such a hot topic for more than a year, and the thing that really is interesting is that it is such a small virus which has turned our lives and the world upside down. And so every day there is new information coming out regarding the etiology of the virus, etiology of the COVID-19 infection, and the treatment, and now the vaccination. So I think we would like to start with the COVID itself, as to find out what COVID is and how is it spread. And as we know that the spectrum of the disease is quite wide. Some people will have lung related issues, but some people will have no symptoms whatsoever. Right. So because of the wide spectrum, I think the first thing to know or to ask would be, what in your experience have you found to be the symptomatology of the infection?
So first of all, I would like to point towards nomenclature. A lot of people think about COVID-19 is what is COVID-19 and what is SARS-CoV. So COVID-19 is the disease itself, and SARS-CoV is the name of virus that causes that, SARS-CoV-2. And as far as its symptomatology is concerned, it has a very wide symptomatology. It can range from no symptom at all, that somebody has an exposure and was positive, never knew, and that's it. And it can vary from just like a viral syndrome, fatigue, fever, not feeling well, nausea, to all the way to lower respiratory tract infection, cough, fever, and then progressing to shortness of breath, low oxygen level. It can also involve GI tract with diarrhea, poor intake, poor appetite, low intake, and occasionally I have seen some neurological manifestation as well, confusion, and I've seen people coming in, they were unconscious and confused. So it has a very wide range of symptoms.
So when you say very wide range of symptoms, so I think it makes it even more important to realize that there are patients who do not have any symptoms whatsoever.
Right, that is correct.
So, and I think that is where it is even more important for everybody to be taking precautions, because somebody may have COVID and not know about it.
Right, right.
So let's talk about mode of transmission, because if a lot of us don't know how it's transmitted, we may not be doing the right thing to protect others.
Right. So when it started, we knew very little about the virus. We still, I think, know very little, and we will know as an after fact. But the main mode of transmission is the respiratory tract. and it's spread through droplets when people cough. The virus is in their droplets. It settles down on the surface. If somebody was here before, coughed, and there was droplet on the surface, I come back, touch the surface, and now it's on my hand, and at some point I'm gonna touch my face or nose or mouth, and it would be transmitted to my respiratory tract that way, and it can lead to from all the way from asymptomatic infection to nothing, and maybe full-blown pneumonia. And sometimes it can cause conjunctivitis by spreading by touching the eye. Conjunctivitis is an infection of the eye. So these are the main mode of transmission.
So I think early on there were some cases where people were saying that you can get it even if you are breathing air which may have COVID. So what would you say about airborne transmission?
So difference between droplet transmission and airborne transmission, it would get a little more technical. So there is some chance that it can be airborne for at least for a period of time, but I think we should stick with CDC recommendations or precautions and keeping droplet precaution. In certain cases, we need airborne precautions, but I guess for common people, this can get very technical when to use N95 versus a mask, and what is aerosol procedures, and when to use N95. But briefly, if somebody is on aerosol procedures such as nebulizations, on BiPAP, these kind of procedures, airborne precaution should be used, or any procedures are done in which are high risk, such as bronchoscopy, endoscopy, transesophageal echocardiogram. Airborne precaution should be kept, but again, for a common person, it can get too technical,
too involved. So at the same token, who do you think would be greater risk of catching the infection? Of course, we are now seeing that a lot more people are getting vaccinated,
right,
but we still need to be careful and stay away from folks who may be at high risk. So I think for general public knowledge and for general information, it would be worth to maybe restate some of the conditions which may be at high risk for developing COVID-19.
So the biggest risk factors that we have seen is, number one, obesity and diabetes mellitus. So if somebody who's overweight, obese, and have diabetes, they are the people who are most at most risk. And then vulnerable population, elderly. The highest number of or prevalence of this disease, or the age group that has developed COVID-19 disease, were the younger people. And an assumption there is, since they were going out and doing more stuff, so and may not be as careful, they got the disease more than other people. But of course, elderly are very vulnerable. People who have multiple comorbids, they are vulnerable. Children does pretty good with the COVID. The mortality and morbidity means that it's not that they cannot get sick, but the risk of a healthy child developing a COVID disease to a point that it can lead to death, risk is not zero, but it's lower than adult population.
Oh, okay.
It doesn't mean that they should not be protected. They should be protected. But one thing that we have to keep in mind, even though children can fight it out better than adults, we should be very careful with the children, because if they are exposed, they can transmit to other elderly or adult or vulnerable people inside the house.
So they are basically the spreaders, if you
They
would.
can be spreaders. There are some studies coming out that it practically did not happen. But again, we will know it as after the fact.
Yeah, sure, because this is a new virus, it's a new disease. A lot of studies are being done, and every day we hear something new about the symptomatology, about the treatment. But you being in the hospital most of the time, when you see folks who have come down with COVID-19, who do you find mostly who gets hospitalized or ends up in ICU?
So we have seen that African Americans are and Latinos, Russians, they were more prone to get severe disease. Because in ICU we get people who try to manage themselves as an outpatient, then inpatient, and did not respond, and finally come to ICU. So we see Asians, Indians, Pakistanis, Bangladeshis, all races. The virus does not spare anyone,
Sure.
but somehow I have seen more disease in African Americans, Latinos.
And that is interesting. And as Dr. Sheikh said, virus does not discriminate. So everybody and anybody who is around vulnerable population, they should definitely be taking care of themselves so they're not spreading it and taking it to others. So let's also talk about, when patients come down with COVID-19, of course, when the diagnosis is made, and we're not talking about diagnosis because everybody's going and getting the rapid test or the PCR test, but once a diagnosis is made, the patients get very alarmed, and because there is such a hype about COVID in the media, that people say, oh, now I am down with COVID, is this a death sentence? And so what kind of treatment and when should a treatment be looked at for these folks?
So, as I mentioned before, that the symptoms and disease severity varies widely, and it can be, from asymptomatic to all the way requiring ventilator.
Sure.
So, most of the time, patients can be managed at home. It is very important for these people to isolate themselves to protect their families and the community. And at the same time, the families should make a cautious effort to make sure that their family members is isolating in a separate room. They frequently check on them to make sure that they are doing okay. Just like any other viral illness, a lot of water, plenty of rest, and making sure that you get optimal nutrition, some exercise as much as you can do. But if the symptoms become so worse that one cannot take care of themselves at home, and it gets to a point that if they feel that they might pass out or they cannot breathe, then don't wait too long before seek help. Primary care physicians are playing a great role in this regard, guiding their patients. A lot of these patients have bought pulse oximeter, which is a small instrument that they can check their oxygen level just putting it on the finger. And if somebody noticed that their oxygen level is coming to a lower point, let's say 92% when they are walking around or with exertion, that's definitely a point that they should seek medical care.
Okay, good. But are there any treatments that patients can be prescribed by their primary care
Sure.
doctors, or should they just rely on in-hospital treatments?
So primary care physicians have tried different things, and there are tons of different studies, small studies which have not made their way to guidelines. People have used vitamin C, vitamin D. Some people have used vitamin K, zinc. Um, Previously, anti-malarial medication was in the picture as well. Then people thought about zithromycin. All of them have been tried and have, except the anti-malaria medication, that should not be used because that has shown some increase in mortality, means increased number of deaths in the people that have used. Other medications are relatively benign. Vitamin C, if they want to try it, there have been anecdotal benefit that people have seen. Vitamin D, if the levels are low. All of these things, and there are many more. Melatonin, Pepsid. There are so many things that are out there with anecdotal response, but not necessarily definitive curative properties, and they can try, but the main thing is they just want to wait for this thing to pass.
So I think if I was to sum up the discussion, because I think we are moving into the treatment
Sure.
zone pretty soon. So to sum it up, I think what you're saying is that the spectrum of symptoms with COVID would be that a person can be asymptomatic, they may have no symptoms, or they can have cough, congestion, neurological symptoms of confusion, even passing out. They can have issues with gastrointestinal symptoms like diarrhea or nausea or vomiting. But there may be people who may not have any symptoms. So it's very important that everybody pays attention to what's going on with their body. They should also use precautions when they are coming in contact with other folks. So make sure you're using a mask, cleaning your hands, washing your hands, using sanitizers. Although vaccination is being done more and more, but I think people who have been vaccinated or who have not been vaccinated, they should all still take precautions till most of the population gets vaccinated and is out of danger. The other thing, as Dr. Sheikh said, that the more vulnerable are folks who have underlying diseases or the elderly folks, and they may end up in the hospital or even in the ICU on ventilators. At this point, there is no cure, no treatment for the COVID-19, but yes, there is symptomatic treatment, like you can take decongestants, you can take cough medicine, and monitor your oxygenation. And if you find that you're running high-grade fever, if you're coughing, bringing up phlegm, or if your oxygenation is dropping, you should seek medical help. Call your primary care doctor or go to the emergency room and be checked out. And in the end, the most important thing is that everybody is responsible, no matter what they have. If they have been vaccinated or not vaccinated, they are still responsible to make sure that everybody else around them stays healthy. But before I end the show, first of all, do you have anything to add, Dr. Sheikh?
Yes. So a couple of things in manifestation of the disease that you summarized. In these patients, we have seen that cardiac events and such as heart attack and what we call as a cardiomyopathy, when the heart is not functioning as well as it used to, it can happen. Patients who had COVID are more prone to develop clots in the body, in the legs, that can travel to the lungs. So these are added things that we have seen. It can involve almost every organ system. And as far as the treatment, you mentioned that there's no treatment available. There's no curative treatment available, but there's supportive treatment available. All those things that we mentioned, they are supportive, and they are antivirals that can be used, that are approved by FDA. Generally, they are given as an inpatient hospitalized patient. There is people who recover from COVID-19, they sometimes donate a part of their blood called plasma, with an idea that they have developed immunity and the plasma had immune component, and when they transfuse that to the patient gets some ammunition to fight the disease. There are other medications such as some steroids are used with an idea that would reduce the mortality, means it would reduce the risk of death. And there are some other medications available as well that can be used as an outpatient. There are some FDA-approved monoclonal antibodies. So there are some other inpatient medications as well. Previously, there was a medication that used in what we call a cytokine syndrome. It gained a lot of popularity, but then it lost its popularity, and it is now coming back to some, according to some studies, but it is still in or out of. It's not definitely in the picture.
Sure.
So there are therapies available, but not necessarily curative therapy, supportive therapy.
And that is nice to know, because as we said early on, that this is a new disease, so every day we are hearing new treatments, new plans, or new medications that are coming out. But as I've always said, this discussion does not make us your doctor, so there's no doctor-patient relationship. If you have any symptoms that you're concerned about, you should consult with your doctor. Whatever we discuss here is purely for informational reasons, and we are not giving you any medical advice. So anyone out there who may be looking at this show or listening to us should consult with your own primary care doctor and decide you need to talk to your doctor to determine what your course of action should be. And so with that, I would like to end this episode, and I would like you to subscribe to our channel, like and share it, so more and more people will benefit from the information that we are trying to provide. And I would like to thank Dr. Naveed Sheikh, who had to take time out of his busy schedule to be here so he can talk to us, and we could share some information about COVID-19 with you. And on the next episode, we will be talking about the treatment and the vaccine, and the COVID-19 would continue on the next episode as well. So I thank you, Dr. Sheikh, again, and I thank you for watching. So take care of yourself,